This webinar provides an overview of New South Wales Health Concise Incident Analysis and New South Wales Health Comprehensive Incident Analysis. I would like to acknowledge the traditional custodians of the various lands on which we work. I pay my respects to elders past, present and emerging, and recognise and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. This webinar provides high-level guidance on the application of New South Wales Health Concise and Comprehensive Incident Analysis. However, we would encourage you to first listen to the Changes to Serious Incident Management in New South Wales webinar on the Clinical Excellence Commission website or YouTube channel for an overall understanding of serious adverse event review requirements. New South Wales Health Concise Incident Analysis and New South Wales Health Comprehensive Incident Analysis are 2 of 4 approved review methodologies used in New South Wales. For each clinical harm score 1 incident, the Chief Executive determines the review method to be used. However, regardless of method used, all review processes seek to answer what happened, why it happened, and what action can be taken to prevent it happening again. At the Clinical Excellence Commission, we've structured all of our resources and around how each review method addresses these questions. New South Wales Health Concise Incident Analysis and New South Wales Health Comprehensive Incident Analysis methodologies, which I will refer to collectively as incident analysis, are broadly based on the Canadian Incident Analysis methodology. We've used the tools and concepts and adapted them for use in the New South Wales health context. I would also like to acknowledge the input of mental health and specialist services in Gold Coast Health, who assisted in further developing our thinking based on their experience with the application of the Canadian model. So how is incident analysis different to other approaches? Well, it does give us more than one method for review. Also, because the approach has been developed specifically for health, the concepts are easily understood by clinicians. There's a movement away from the use of root cause, as it is a misconception to suggest that there's a singular cause for any incident. Incident analysis allows for improved identification of the complexities that contribute to any incident, and the use of a constellation diagram allows us to understand the interconnections between contributory factors. Our colleagues in mental health believe analysis is a reliable tool for the review of community suicides that occurred within 2 to 7 days of last contact with a mental health service. All of these incidents begin with a New South Wales Health Concise Incident Analysis, but then if issues of complexity emerge, a conversation takes place with the Director of Clinical Governance to determine if it's appropriate to transition to a New South Wales Health Comprehensive Incident Analysis. So let's quickly look at the differences between concise and comprehensive incident analysis. The concise incident analysis team is made up of 2 people. One has expertise in patient safety and the other has a good understanding of care delivery processes of the location where the incident occurred, and they complete the review within 30 days. A comprehensive incident analysis team is made up of 3 to 5 people who complete a review within 60 days. The steps that the concise and comprehensive incident analysis teams follow are exactly the same. However, there are some differences in the way the tools are applied, particularly around staff interviews and the use of guiding questions. So there are 11 steps the Serious Adverse Event Review team follow to complete both a New South Wales Health Concise Incident Analysis and a New South Wales Health Comprehensive Incident Analysis. And we're going to work through these and I'll call out where there are differences in the 2 approaches. However, to begin with, when seeking to figure out what happened using incident analysis, there are 2 steps that the review team work through. So, team members are given access to relevant documentation for review, including the incident report, medical record, and preliminary risk assessment. They then continue to gather any additional information, such as relevant policy documents or literature, and they can always complete family interviews and staff interviews. The team might also visit the location where the incident occurred if appropriate. So the Concise Incident Analysis team will only gather just enough information to help them understand what happened. They interview key staff only and limit these discussions to 30 minutes. On the other hand, the Comprehensive Incident Analysis team will undertake a very thorough information gathering phase. Having gathered the information, the team then construct an incident chronology. And to do this, they fill in a table which includes the date and time, if appropriate, a description of the information that's been gathered, and the source of how it's being gathered. So during the information gathering stage, the Concise Incident Analysis team might find that there are issues of complexity arising that weren't obvious at the time of the preliminary risk assessment. So they might believe that a more comprehensive review is needed. And if that's the case, the team members will meet with the Director of Clinical Governance to discuss whether or not to transition to a comprehensive incident analysis. If a decision is made to progress to a comprehensive incident analysis, the new team members are appointed by the Chief Executive, and the old team members brief the new ones about what happened and what additional information needs to be gathered. So, a team completing an incident analysis review work through 5 steps to figure out why an incident happened. The team use a set of guiding questions to assist in the identification of contributing factors. These questions are grouped into domains. The Concise Incident Analysis team only work through questions in the domains that are relevant to the incident. The Comprehensive Incident Analysis team systematically work through all of the questions. So this is a screenshot of what the guiding questions look like. The domains are the headings that are shaded in grey, and the associated questions are listed underneath. The team go on to develop a constellation diagram using the contributing factors, and the constellation diagram provides a visual representation of the connections between the contributing factors. So here's an example of a constellation diagram that's taken from the Canadian Incident Analysis Framework document. And in the model, you can see that in the middle, rather, you can see that we have the incident, and this is surrounded by the domains of the contributing factors in the blue circles, and coming off these are the related contributing factors, and the lines show the interconnections between the factors. So you can find a template to complete a constellation diagram in the Incident Analysis Toolkit on the Clinical Excellence Commission website. After this, the team move on to write up factors linking them to outcomes, and these are documented as statements of findings. So statements of findings follow a format where the contributing factor within the context of the incident either increased or decreased the likelihood that this outcome would occur. A well-constructed constellation diagram will assist with the development of statement of findings, with the team working from the outside of the diagram back towards the centre. Some examples of statements of findings. So at the top in the domain of work environment, there is a statement of finding that reads, the lack of a standardised community health risk assessment tool or protocol increased the likelihood that clients discharged from hospital back to the community would not be accurately triaged to ensure appropriate and timely home care services are provided. And underneath in the patient domain, there's a statement of findings that reads, the deterioration in the client's physical and cognitive abilities increase the likelihood of a medication error in his self-medication management. Next, the team determine the practices, processes, or systems that require review. So, if we continue on with these examples, it might be that we need to review handover processes from hospital back to community health, and then also the process for assessing patient suitability to self medicate. The team then write up the findings report. So, let's take a closer look of what this actually involves. So the findings report includes a description of the incident followed by a sequence of events. The team identify how the incident occurred and list any underlying factors linking them to outcome. They then identify the practices, processes, or systems for review. So this is a snippet from the bottom of the findings report, and it's when the report is submitted to the chief executive, these are the instructions that come following that. So when the report is finalised and submitted to the chief executive, they are responsible for directing whether a recommendations report needs to follow. After this time, the findings can be shared verbally with the family by the open disclosure team, and it's the dedicated family contact who arranges this. Teams who go on to develop recommendations follow 3 steps. So the team brainstorm actions that can prevent the incident or mitigate harm, and in doing so, they have a think about any recommendations that may have been suggested by the family. They assess the strength of each action against the action hierarchy, ensuring there are at least one strong or intermediate action for each factor. And it's at this time that the team will consult with other services if actions are recommended that for services that aren't represented on the serious adverse event review team. And an interview letter is issued beforehand to ensure that privilege is maintained. So this is an example of an action hierarchy, and this states that stronger actions are the best at removing the dependence of the human to get it right, while weaker actions are ones that support or clarify a process but rely solely on the human to get it right. In other words, stronger actions look at review or redesign of processes to ensure staff take the right action, whilst weaker ones remind staff of what the right action is. So for each recommendation, an action plan is developed that includes a due date, an outcome measure, a person responsible, and an oversight committee. The team then finalise the recommendations report and submit to the Chief Executive for approval. When the report's approved, it's submitted to the Ministry of Health with the findings report. Let's look at where you can find more information. So for more information on incident analysis, you can visit the Clinical Excellence Commission site where you'll find one incident analysis toolkit, as well as a concise incident analysis workbook and a comprehensive incident analysis workbook. The incident analysis toolkit includes step-by-step guidance on the process to follow, as well as detailed instructions and examples of tools that have already been populated using examples. The 2 workbooks have been designed for the serious adverse event review team to work through at their meetings. So there's a breakdown of steps to work through in each meeting, and there's a checklist of steps to be completed. All of the templates are included and they're empty with just instructions. There's also additional planning templates like Gantt charts, fillable forms, and so on. So thank you for listening to this summary of the steps involved in completing an incident analysis. Feel free to contact us with any questions that you may have, and you can do that by emailing us on the address that's on your screen.